Hi everybody, Dr. Suneel Dhand, internal medicine physician. I hope you all had a fantastic, relaxing Christmas. I certainly did. And I spent a decent amount of Boxing Day actually listening to the radio, Test Match Special, and hearing England get absolutely hammered by Australia, unfortunately. The great Jonathan Agnew was commenting for much of the time. And I'm well aware that most people watching right now, especially in the United States, have no clue what I'm talking about from Boxing Day to Jonathan Agnew. So let me move on to something that you do hopefully understand better, and I will explain. Novavax, the traditional COVID vaccine, seems to be imminently being released in many different parts of the world. And back in August, I made a video on Novavax, and I talked about how it is synthesized, what type of vaccine it is, and the promising study results that we had seen so far. The link is down below. Please watch that if you haven't already. The study that I went over from the New England Journal of Medicine was indeed extremely promising, showing equal, if not superior efficacy than research results from many of the other mRNA vaccine. Those study results were released months earlier. And what I particularly liked, and I went over in that video, was that the studies of Novavax included many more people who were from vulnerable groups. Novavax also has certain other advantages as well, according to the data we've seen so far, including fewer reported side effects and also the fact that Novavax doesn't need to be stored at very cold temperatures. It is also cheaper, and that is very promising for poorer countries. That's been something that I've been big on for the last few months. We have to self-reflect in the West, in richer countries, that as many of our vulnerable groups are being offered their third or even fourth vaccine in some instances, many other vulnerable groups across the world, elderly, those with comorbidities, haven't even had the chance to be offered a single vaccine dose yet. But hopefully vaccines like Novavax will get to them soon. I also, in my last video, went over an article in The Atlantic that talked about Novavax in detail, and it was actually titled, "mRNA Vaccines Are Extraordinary, but Novavax is Even Better." And in this article, they actually said that Novavax so far had shown substantially fewer side effects than other vaccines, which is a good thing. Within the last couple of months, Nature.com also published a piece about how Novavax and other protein vaccines could be game changers across the world. To recap again briefly on Novavax, it is a vaccine that actually contains the spike protein from the virus, which has been synthesized, and it's added to an adjuvant. I went over this in my last video. It induces an immune response to give you antibodies. How is this different from mRNA vaccines? Well, mRNA vaccines use mRNA to instruct the body to genetically produce the spike protein, which then elicits the immune response. That is the key difference. So in that respect, Novavax is much more similar to traditional vaccines in directly inducing an immune response. And in fact, it's the same technology that is used in hepatitis B and pertussis, that is whooping cough vaccines currently. And a quick recap again on how vaccines work, because there's been a lot of confusion over the last couple of years, and I've said this before, vaccines don't magically give you antibodies. Vaccines make your body produce an immune response that gives you antibodies, and that's why I've always kind of smiled over the last couple of years when there's a certain segment of people out there who continuously almost seem to deny natural immunity. Well, how do vaccines work? Vaccines work by taking advantage of your natural immunity. Therefore, if you deny natural immunity, you are also denying vaccinated immunity. Think about that logically for a second. Let's come back to Novavax and particular developments then over the last several weeks, because when I made my video in August, it seemed like it was imminently going to be released, but apparently the company has been beset with manufacturing issues which have delayed its production. In November then, Indonesia became the first country to officially authorize the Novavax vaccine. Indonesia, population 275 million, and it's the fourth largest country in the world. So a huge amount of people are about to have access to Novavax. Within the last week, the World Health Organization issued an emergency use authorization for Novavax, making it the 9th COVID vaccine to be approved. It is called Novavax, and it's actually manufactured by an Indian company under Novavax's license. And also within the last few days, the European Medicines Agency has recommended granting authorization to Novavax, and the expected date of delivery is the first quarter of 2022. In addition, I'd also like to add that I read some recent data showing that Novavax shows a very promising immune response against the Omicron variant of COVID-19, which is very pertinent for the situation we're dealing with now. As for the United States, what's going on? Well, I did read that FDA submission is looming. So I do hope that Novavax is going to be released in the United States soon. I was recently watching cable TV. Poor me, I was flicking through the channels and I stumbled across a financial channel. And they had this whole segment on vaccine market share and how different companies were battling for vaccine market share. There was no talk about the science, no talk about how COVID-19 was affecting people. They were simply focused on the financials. And we have to be realistic here. And I say this as someone who's lived in the United States for a few years and understanding how things work. I really hope there's no strange behind the scenes lobbying going on here. Because let's be realistic. These vaccines have generated billions of dollars for many companies all across the world. So no company is going to want to, quote unquote, give up its market share. Now, I am no socialist. Capitalism has many positives, but it also has many drawbacks. And if we are going to allow companies to make billions of dollars, then we must also allow a fair amount of competition and there to be an even playing field. So if Novavax is approved in many other parts of the world, there's absolutely no reason why we shouldn't see it in the United States very soon. Anything less would be unacceptable. The general public deserves access to a wide range of vaccine choices. Let's all be watching very carefully over the next few weeks to see what happens with Novavax. Thanks everyone for listening. Dr. Suneel Dhand, MedStoic Lifestyle Medicine. Join me as well on locals.com. It is an uncensored platform. Link is down below. We'll speak again very soon.